I might say bonjour. Good morning, everybody. So I can see that I'm the only francophone in this tremendous panel, but double challenges: share the experience for healthcare in Mali and also try to express it as I can in my English. First of all, I'm very extremely honored to be here today and address the distinguished audience. Let me begin by extending the Minister of Health of the Republic of Mali, the new minister, Michel Sidibé, who is well known. He was the former director executive of the UN AIDS. His warm greeting to you and regret for not being able to be here because in Geneva for another meeting. He wished you a very productive summit. This is an Eastern proverb. Health is the treasures of life. Indeed, health is the basis of everything in life. We cannot talk about development unless our countries can ensure good health to its population. As it's said by my predecessors here, you can see that Africa health is our common challenges. Without health and education, it's difficult to talk about development. Mali is a country, the largest country, 1,002,041 kilometers square, is facing today to the security challenges related to terrorism, but at the same time, it affects the healthcare system because in the north where the terrorists are operating, people are displaced in the south, so the government should continue to provide education, security of the population. Our president, His Excellency Ibrahim Boubacar Keïta, understood this situation and put access to healthcare in the heart of his political vision. His decision to make free of charge primary curative and preventive health care for children under 5, pregnant women, including childbirth, and people over 70 years old was very much appreciated. In addition, services such as family planning, dialysis, and first aid in cases of emergencies is all health facilities are also free for all in Mali. You know, health issues is like this. If you have the quality, it should be access for everybody. So that is the main point and the main challenge for Africa. We should do it for everybody, making it easily. And somebody was saying the money we spend to send the people to the big hospital in the world, this budget, we can manage it and try to have the same quality and standard of hospital in our countries. In fact, there is important reform going on to make this sector performant in Mali. In its current situation on health system faces many challenges, including the quality and the organization of service, also like modern equipment, supplies, and obsolete infrastructures, but also health financing. That is also one of the challenges. As you may know, since 2012, Mali has been going through a multidimensional crisis that affected all sectors, despite its importance, like healthcare could not be an exception. As the result of this security challenge, Mali invests an increased amount of resources in the fight against terrorism by hiring more soldiers and buying more equipment. Almost 23% of the budget is allocated to the security issues. 15% is allocated to the agriculture. At the same time, we have also to respond to social demand at all aspects. Some of you may recall Bamako initiative. Bamako is the capital city of Mali, considered to be the first comprehensive approach to improving healthcare in Africa. was agreed by African health ministers in 1987. This important resolution has faced many challenges in its implementation, including its own limitation. Thanks to the collaboration between the University of Science Technology of Bamako and the National Institute of Allergy and Infectious Disease, NIADIS, and NIH has established on-site staff in Bamako, working in close associations with the School of Pharmacy to promote research and training on tropical and infectious diseases. And we have very prominent professor in health who was training in the US and other countries, and today continue to share the result of the research on malaria. Some of them you may know, Professor Ogobara Dombo, who passed away, and he did a very good job to find a vaccine against malaria. This partnership has reached many milestones, including the Center for Research of Training, who is the second in Africa after South Africa. Malian scientists are open for this type of collaboration with all of you and with the United States and with African countries. I believe that collaborations on other emergency diseases should be explored by this gathering. For instance, cancer research centers are an interesting area of focus as cancer is more and more prevalent in our countries. Let me say a few words on Mali health system care. Mali healthcare systems is organized into four tier system. At the top, we have four national hospitals, namely Hôpital de Poingé, Gabriel Touré, Hôpital du Mali, and Kati. These hospitals provide the best healthcare in the country. They even have some advanced facilities. At the second tier, at the 7 regional hospitals in the administrative region, the regional hospitals supervise the referral health centers, which can be found in each district. The second tier also, we have also a common health center called in French, Centre de Santé Communautaire, which acts as healthcare facilities at the community level. These centers only provide basic medical care and are specialized in maternity and pediatric. All levels, however, suffer from a critical staff shortage, which a disparity in the doctor to the population ratio between urban and rural area. Despite effort to increase public budget allocated to healthcare, up to date, equipment and medical supplies are insufficient. Understaffing is also a large issue for the Malian healthcare system. That's why many private health centers are opening doors to take advantage of opportunity. In this area also, the government should make more vigilance and to control. Although there have been significant improvement in the health sector in Mali, the country continues to face serious challenges in the health sector with some of the world's worst health indicators. Mali has a strong cooperation with the US on healthcare sectors. And you may know how Mali succeeded to Ebola eradication. We really, it showed that our president at that time said, that is a national defense issue. And we refuse to close the border with other neighboring countries because we think that that's not the best way for Africans to protect each other. We should work together, working with the neighboring village and share our experiences. So still we continue to provide this solidarity to other cities. I would like to express Malian people appreciation for the good cooperation between Mali and the United States of healthcare sectors. Through USAID, Mali benefits an important support from the United States in terms of building critical human resource capacities, promoting increased adoption of health behavior for nutrition, health and hygiene, and fighting against some neglected tropical disease. In addition, Mali is also a President's Malaria Initiative focused country. Some of our priorities include what was said before by my predecessor. The challenges and the priorities are construction and equipment of health centers in newly created administration and all villages in the country. Support to existing public hospital with modern equipment and materials. Education and training to strengthen human capital. Establishing collaborative research initiative. Before I conclude our health diplomacy with my friend from Mozambique, because we are not experts, but we should highlight what our government has done in these issues, and also listen from all of you. Maybe in our report we can also contribute for the different initiatives ongoing in the countries. Before concluding, I would like to extend heartfelt thank you to Professor Ngwa for inviting me to this important gathering. I look forward to more discussion in panel. Thank you very much, and I hope I did my best to be understanding in this. Thank you so much.